Well, thank you, Madam Chair, and Ranking Member Burr for having this hearing. Thank you to all of our witnesses for your extraordinary hard work and for your commitment to helping us get through this pandemic and beyond. I also want to just take a minute to thank Senator Kaine for the remarks he just made about the importance of mask wearing at this moment in time as we continue to combat the pandemic. As somebody with a highly vulnerable family member who is cared for by a woman who is 80 years old, I have been holding my breath throughout this, and the fear is real. So I am very grateful to you, Senator, for your comments. Dr. Kessler, earlier this month, I led a group of my colleagues in writing a letter to the Departments of Health and Human Services and Justice to urge them to address serious barriers for individuals with disabilities in the COVID-19 vaccine distribution process. This letter followed reports from constituents in my home state of New Hampshire that they could not access the vaccine registration website using a screen reader, which is a crucial tool for people with vision loss. Ensuring that individuals with disabilities and other vulnerable communities can easily register for appointments and access vaccination sites is essential for an equitable distribution of the vaccine. So, Dr. Kessler, how will the federal government partner with states to improve access to the COVID-19 vaccine for individuals with disabilities and older adults?
Senator, absolutely key points, and no doubt we can do better on that. I think we've all been frustrated getting appointments, people staying up throughout the night, refreshing their computers, trying to get appointments. What we've been trying to do is to increase the number of access points, increase the number of vaccinators. As you've heard, we are going to increase, not only we're increasing the number of appointments, the vaccinators, the number of sites, but also working on the information systems. This was a mad dash getting this out, and what you see is just very real. But there's a real commitment at the state level, at the federal level, to improving those information systems and the ease of use. Right.
We
right. have to do better.
Yeah, I appreciate that. I just also want to point out that as a civil rights issue, the Americans with Disabilities Act does apply here. And it's really critically important that whether it's a telephone system that somebody who has a hearing impairment can use, or a screen that somebody with a visual impairment can use, or a vaccination site where somebody who might have difficulty being exposed to bright lights, or a lot of noise for long periods of time has space to be. These are all requirements under the law for access. And it's another time we'll have another discussion about how far the healthcare system has to go in this kind of accessibility generally. But for vaccinations right now, it is an issue we're hearing about a lot from constituents. So I just wanted to bring that to everybody's attention. Let me move on to another question for Dr. Kessler and Dr. Fauci. As vaccinations continue to ramp up across the country, you've both mentioned the possibility that we will need to develop booster shots to ensure long-term protection from COVID-19 and respond to existing and future variants of the virus. Are there additional steps we should be taking now in order to ensure that Americans will have timely access to any necessary COVID-19 boosters, and make sure that they will understand the importance of taking them, including when the current public health emergency declaration ends? Maybe Dr. Kessler and then Dr. Fauci.
First, we are looking at the data. We know, at least for some of the vaccines, that there appears to be durability at the 6-month point. Yeah. Now, the reason I use the 6-month point is that's because how long the first people have been immunized. So we're continuing to monitor that. And I think what we see, the good news is that durability seems to exist. There is a slow decline, and there is some variability between individuals, right? So we can't sit here today and tell you when, and definitely there will be boosts. But I think we have to plan for it, and I think at some point, my colleagues, I think it may be more likely than not that at some point we will need to boost with the durability, but it depends on a number of questions. So we need to make sure that we have enough vaccines in the cupboard, right, that are ready to go when we need to do that, and we're doing that planning, Senator.
Dr. Fauci, do you want to, I know I'm a little over time, but if you could quickly comment.
Agree completely with Dr. Kessler, but let me just add one thing that adds into the mix of variability, is that there is a considerable degree of variability across the population in the responsiveness to the original vaccine. Remember, we have a lot of people in this country who have underlying conditions. Many people are on drugs for autoimmune diseases, cancers, and things. They get vaccinated, their level of antibody may not be as high or even multifold lower than an otherwise normal, healthy young person. That person would likely need to be boosted well before the others. So as Dr. Kessler said, there's a considerable amount of variability. What we need to find out is what's the minimum cutoff? Where's the point where absolutely you've got to start giving boosters? And I think we don't know that yet. We just have to follow people long enough to know when the level of antibody goes way down. Because a healthy person may hang up there for months and months and months. Somebody who's on chemotherapy for cancer or glucocorticoids for an autoimmune disease may come way down. That's the point.
Thank you, Madam Chair.
If I may, Senator, may I just chime in and let you know that CDC does have active, on your prior question, active toolkits and playbooks for folks with disabilities. We're working with our local partners and jurisdictions to make sure that vaccine sites have equitable access. There's access in other realms. So I just want to let you know those resources are available.